What makes it different for the thousands of healthcare products which are made in compliance with the principles of CGMP, Current Good Manufacturing Practice? The critical factor is that people who are ill or injured are less able to withstand the additional trauma induced by medicines, devices or equipment which are faulty or contaminated, degraded, are no longer used or to assist accurate dosage. Packaging must protect the product from external threats to its stability without itself imparting any damage to it. For example, it must not be made of materials which release chemicals or vapors that could react with the product and damage it. Patient or medical practitioner. Where the product is subject to terminal sterilization, then the packaging material must meet varied and appropriate criteria. For example, glass and closure materials must be resistant to the operating temperatures in steam autoclaves. It's a legal requirement that packaging must provide essential information about the product, starting with what it is, what form it's in, such as tablets, capsules, an injection, or any other medication, manufacturing batch number, or how long it's safe to use. We may also need to know other things such as how much to take, how to take it, and how often. And that's not all. Called primary packaging materials are the packages or containers that are in direct contact with the product, which include the main container, cap, closure, or strip or blister packing material. Packaging relates to the components which are used to enclose or to protect the primary package, and are known as secondary packaging materials or secondary packaging. This applies to bottles packed in cartons, which may include other items, including dosage aids, such as spoons or droppers, and leaflets, which means that samples from every delivery of incoming packaging must be inspected for quality, including dimensions, that it's made from the correct materials, that it's been cleaned correctly, either before arrival or in-house, and that it's important to wear the appropriate clothing, and no less so that it's correctly fastened, and, just as important, to ensure that your ears and hair are properly tucked into your head covering rather than being used as a fashion statement. That up to 80% of all product recalls are caused by errors of packaging or labeling, which highlights the need for the utmost care and total and absolute control to be exercised when handling and using printed packaging materials. Before starting any new packaging operation, it's essential to ensure that all materials and components from the previous job have been removed, that all line and area cleaning has been completed and checked. For the packing process, all bulk materials and packing components and rejects must be reconciled with the number of units produced. Any significant or unusual discrepancies must be fully investigated and satisfactorily accounted for before release, when packing is complete and final release conditions have been satisfied. Finally, the machinery, equipment and packing area should be cleaned and any contamination or extraneous material removed following the batch clean-down procedure in readiness for the next product.